Hi, I'm Gabriel, and today I'm going to be doing my newborn assessment for my maternity OB class. This is at home, and anyone can practice this on a doll or themselves or by watching some videos. So I want to start by making sure we're in a draft-free, warm room so our baby doesn't get cool, and getting some history on the baby. So this baby had a cephalic presentation for delivery, and that's going to be important to know. And we'll say they were born at 38 weeks. So when we start our assessment here, we actually want our baby, we don't want clothes on them if they have clothes on, so we're going to remove these. Carefully, and we're going to wrap our baby up in a blanket for our assessment to keep them warm. And this baby has a lot of hair, by the way. So you want to talk to the baby while you're doing your assessment, so I'll even introduce myself and tell the baby my name is Gabriel, and we're going to start by getting a set of vital signs. So with our vital signs, we want to do temperature last because it's axial, and sticking a cold thermometer in their armpit can really change their respirations or pulse rate. But, so we'll take our stethoscope here, and we'll get their pulse and respirations for 1 full minute. There we go. And while we're getting our breath sounds and getting their apical pulse, you want to listen for any murmurs, any adventitious breath sounds. If there's crackles or wheezing, you really want the lung fields to be clear. And the range we're looking for here is the pulse should be between 120 to 160 beats per minute. And so it may be really hard to keep up with that, and if it's faster than you can count, that's usually a good sign. And respirations, you want those to be between 30 and 60. Some sources say 40 to 60, but I've been taught 30 to 60. And then we'll go ahead and take our baby's temperature. So we'll say this is the probe. We're going to go up and down in the armpit like this. And then cover our baby back up. You really want that range to be in between 97.7 and 99.5 or 100.4 is what I've heard. And that will kind of determine if our baby is ready to take their first bath. So if their temperature is pretty low, like say 90, even 98, you might want to wait for their temperature to go up before we put them in even warm water. Just taking their clothes off can really cool the baby down, and we want to wait until their temperature is high to do that. So we've got a set of vitals, and we know some of the history on the baby, so we're going to start with our assessment. So first we're going to just uncover the top half of the baby and keep her bottom half covered. Your baby would have a cap on, which you can keep on until you're doing your assessment on their head. But first we're really looking at the skin color. They might have some jaundice on their face or yellowness, and we can test their skin by pushing on it and seeing if there's blanching, which is good. And we're also looking at their hands and later on at their feet for any acrocyanosis, which can actually be a normal sign, but when you're doing the APGAR, that does give them a little bit of a lower score. But our baby is not cyanotic. Her skin is pink all throughout, and she's looking good. So we looked at her temperature, got an axillary temp. Her skin feels just a little cool because she's uncovered, but that's okay. And so now we can go to her mucous membrane. So while we're at her head, we can take her cap off. Let's see if we can see here. So we'll remove the cap. This baby has a lot of hair. But we're going to inspect the skull. You want their skull to be symmetric and even throughout. It should be round, but since our baby was born cephalically, they might have a small hematoma or some asymmetry, and that's okay. But we're also going to palpate, let's see, the fontanelles. So they should be soft on the anterior and posterior side, and if they were like sunken in, or if they were sunken in, the baby might be dehydrated, but if they were overriding, I've heard that's a normal finding. And we're also, so noting with their skin, we're looking for birthmarks, rashes, definitely, any abrasions, and later we'll look at the Mongolian spot. But also with their head, so we describe her fontanelles as soft and open and flat. They're not bulging or closed yet, and these don't typically close till around 2 years is what I think I saw. So going on, going to check the baby's ears. So their ears here should be aligned from the side of the eye to the top of the ear, or on the ear. So if their ears are really low or really high, that's something we're going to look into further, maybe call the provider or do a little bit of research in my case, I don't know. So, but we're also wanting to make sure the ears are patent, so we can do a clap reflex, and the baby should startle, open its eyes, hopefully not start crying, but it will be aware that you clapped and it can hear you. And typically they do a hearing, like acoustic test with the beeps that we've all probably done as part of like routine screening. So after the ears, they were patent without any drainage, we'll go to the eyes. So we're looking at the color, size of her eyes, bilaterally, and if there's any swelling that might be normal right after birth, as well as we want movement in the eyes, and again, we don't want them to be cloudy, and we're also assessing for any drainage. Okay. Going on to the nose, with all their facial features, we're really looking at symmetry, size, and shape. So with the nose, we also want to make sure it's patent. If their nostrils are flaring, that might be a sign that they're not getting enough oxygen, or they might have some abnormal breathing. But her nostrils are good. And looking at the neck, also size, babies have a short neck, but we want them to have full range of motion, and later you'll see that she should be able to support her head and neck and her entire body weight when she grasps my hands. But while we're up here at her face, we can put a glove on. So I'd glove up. If I needed to foam again, I could. But I'm going to take my pinky here, and we'll do a couple reflexes. So the root reflex, we're just going to brush the side of the baby's face, and they should turn and come to your finger like it's a nipple. And so we'll go in like this, and the baby, if they have a suck reflex, they'll start sucking on your finger, and while they're doing that, you're going to feel for the soft and hard palate, and you're definitely going to want to document if that sucking reflex is intact. Going on here, we'll put the cap back on and go back to the upper chest and abdomen. So looking at symmetry, making sure they have all 10 fingers, and size, shape, and most babies should have a barrel chest and a rounded abdomen, and that is normal. Since this is a female baby, she might have some breast engorgement, and she does just a little bit, but she doesn't have any discharge, and the baby's been very active and has had full range of motion in her arms. We're also going to want to feel the clavicles here for any ridges. Depending on what type of delivery the mother had, it's possible that there could be some damage to the clavicle or a lower hanging arm on one side, and we'd need to look further into that. Okay, going on. We auscultated the baby's heart and respirations, and it was equal, unlabored, and even breathing throughout all lung fields. Breath sounds were clear, and she has a weak cry, but it's not a shrill cry. So going on to musculoskeletal, that's just looking at our baby's activity. Are they active, quiet, lethargic? Looking at their muscle tone throughout, and seeing that range of motion. And then going on, we're going to look at the baby's abdomen. So like I said, it should be rounded. They kind of have a barrel chest, and it's soft, and if their skin is shiny, we'll also want to look more into that, or if it's if it looks full. But bowel sounds, take our stethoscope back out. A lot of sources say there's all 4 quadrants on a baby too, but there's really just 2. So you want to make sure you listen all around in their abdomen though. And her bowel sounds are normal, active, high-pitched and gurgling, just like you'd find on an adult. And we also know that she's had 1 bowel movement already, and she's also voided once. So going on to the lower extremities and the genitalia, I'm gonna uncover the bottom of the baby, keeping the top of the baby warm. And I'll move here so you guys can see. For a female, the genitalia might be a little bit swollen or have some clear discharge, and that's normal. So we'll say she does have that. If this was a boy, I'd look at the testes to see if they've distended, and you do that by just placing your finger in between the penis and the scrotum and feeling the testes. And circumcision is a whole nother story, but we'd want to, they usually do that the day of discharge, and we'd want to make sure that's healing properly and the mom has been educated. So going on, I did mention she had a bowel movement, and it was a meconium stool, not transitional yet, and the meconium comes from old amniotic fluid, and that's something we can educate the mother on too, is knowing what to look for, healthy weight changes, when their baby should regain their lost weight back, and a baby should really not lose more than 10% of its birth weight and then they're going to gain that back. And you're going to want to look at their bowel movements for 5 days and then onward, but during that first 5 days, that's when it's transitioning into normal stool from the colostrum and the breast milk. Going on, we'll move to the feet. So we're also looking at the skin on the legs and the feet. It is pink all the way around. There's no redness or rashes. So with the baby's feet here, and this baby should be pretty active during your assessment. With the baby's feet, we will do a Babinski reflex and the plantar grasp. So the Babinski, you go up along the lateral side of the foot, and their feet should flare out. And this only happens for so long before this reflex goes away, and that's why we want a negative Babinski in our adults and a positive Babinski in our infants. And plantar grasp, if you put some pressure up here on the foot, their toes should curl too. And the same is going to be with the hands. So if we go back to the hands, they should have a palmar grasp and their fingers should curl. And here we can do the Moro reflex. So we gently lift the baby up, and when we drop them back down, the Moro reflex, or I've seen it done like this, where you have the baby and their arms have to be out. And we're playing with them and we toss them up and they come back down. They should be startled and their hands will flare out like this. We'll cover them back up. But we also did the clap, the Moro reflex, Babinski, plantar grasp. And I think that's coming to the end of our assessment. We also want to, if you're doing measurements, you can do that, but on our newborn assessment, we're going to look at their back, and we're looking at the spine, making sure it is even and symmetrical. There's no deviation or scoliosis or lordosis, and specifically we're looking, well, we're looking at the rectum, but while we're here, we're looking for a tuft or dimple, and this is why mothers take folic acid, is to prevent spina bifida in your babies, which is what I know is an open neural tube. So we're assessing for that, and also looking at the rectum, which we can do the rectum when we do the lower extremities too. But after our assessment, we're going to diaper the baby back up, put their clothes back on them if you have them, and hopefully we'll be returning the baby to the mama. Thanks.